Good evening, and welcome to June's edition of the Ask Mary and Pat Show featuring Miss Mary Fenner, Miss Pat Boca. We are so glad that you are joining us this evening from wherever you may be. And to the ones who will be watching the recording later on, thanks for tuning in. My name is Thomas Robertson, but everyone knows me as Duke. I am behind the scenes today. I am the Technology and Metrics Director for Oak Hill Regional CDC, which is the parent corporation of Healthy Kids Mississippi. We recognize our board chair, Jennifer Garrett, our executive director, Dr. Michael O'Miner, and our project director, Mrs. Lottie Miner. In addition to this Zoomcast, we are restreaming this evening's webinar on our Oak Hill Regional CDC and Healthy Kids Mississippi Facebook pages. Feel free to like and share on your social media pages. Also, post any questions or comments in the Zoom chat or in the social media comments. We will do our best to respond to each question. Before we get started, here are a few reminders. If you haven't downloaded the Oak Hill Regional CDC app, please take time now to do so. It is free of charge and it is in the Google Play Store as well as the Apple App Store. All you have to do is search Oak Hill Regional CDC or Mississippi Healthcare Help, and it will pop up for you. And did I forget to mention that it is free of charge? So please take time to download that ASAP. Some may be driving, and I don't want you to be texting and driving. So just listen to what's going on today. But please remember to search for Oak Hill Regional CDC in the Google Play Store for Androids and Apple Store for Apple devices. Our next third Wednesday parent resource chat is usually the third Wednesday of every month, but for July, we will be taking a break and we will come back August, let me make sure I have the right date, August 16th. That will be the next third parent resource chat. And I'm sure we'll be featured about back to school. And also the next Ask Mary and Pat webinar, Ask Mary and Pat show will be July 31st. And we will play those announcements later. So without holding up any more of the time, I'm going to turn it over to the hosts of the show, Ms. Mary Fenner and Ms. Pat Boca.
Good evening. And of course, it's Mary and Pat, and that looks like me on the left and Mary on the right. But however, I'll go ahead and get started. Mary?
Good evening, everyone. You want to start, Pat?
Okay. We just want to say good evening to each and every one of you joining us for Ask Mary and Pat. We're excited. We already have a lot of questions, and we do, as the Duke said, we want you to put any questions you may have in the chat. And if you're on social media, you can enter them there, and we'll do our best to answer them. But I am a navigator and a sister with Oak Hill Regional Community Development Corporation, Healthy Kids Mississippi, and Get Covered Mississippi.
I am a navigator as well. My name's Mary Fenner, and I'm a navigator and a sister with Oak Hill Regional Community Development Corporation, where we help our people with health insurance, with people in Mississippi with health insurance.
Okay. Well, again, we have quite a few questions, so we'll go ahead and get started. And the first question we have is, what should I be doing now to prepare for Medicaid renewal since the public health emergency has ended? Okay, and that public health emergency, I know you all have probably already heard about it, but it is the COVID-19 public health emergency that was put in place back in March of 2020, and it ended in the end of March of 2023. So that means that if you haven't had your Medicaid renewed, it's going to be time. Within the next 12 months, you'll be hearing from your Medicaid worker about Medicaid renewal. So be prepared for that. And also for those that are 19 and older, or those that previously qualified during the pandemic or the public health emergency, if your income exceeded the limit, your Medicaid will end as well. Okay. Okay. Now answer to the question, what should I be doing now to prepare for Medicaid renewal since the public health emergency has ended? Well, the answer is you should be checking your mail and even your emails very closely, okay, for correspondence from the Division of Medicaid for any updates on Medicaid renewal, the end of your Medicaid chip. If you have a child that has already turned 19 and is presently on COVID-19 Medicaid, okay, you should also contact the Medicaid office if you have changed your address, your phone number, or email address, in case they're trying to reach you, in case they've sent you correspondence or tried to call you. And I would just recommend that if you haven't received anything, well, just be on the lookout for some correspondence, but just make sure that your mailing address is correct and your phone number, you haven't changed your phone number or your email.
Okay. Our next question, can I get you to help me complete my Medicaid renewal application with me, or do I need to go to the Medicaid office or call my worker there? You do not necessarily have to go to the Medicaid office. We can actually help you complete the renewal application with your consent. You can give us a call. You can also do online application, and if you can't submit it, we'll do it online for you. But if you decide to do a paper application and you wanted to take it in, we will take it into the Medicaid office for you. So any type of assistance that you may need with reapplying for Medicaid or any type of information that you need, you can give us a call at 662-298-3584. And also you can send us a text, 662-689-9712, and we're there ready to help you with your Medicaid renewals.
Okay. My children were approved for Medicaid, but my sister's children were approved for CHIP. I would much rather have CHIP for my children because it covers more services, and she is also able to receive orthodontist services for her son who wears braces. Why can't I get CHIP? Okay. Well, the answer to that is Medicaid and CHIP eligibility is determined by several factors, okay? And one of which is income, according to the MAGI, and the other is number of members in the applying family. Your sister's family income may be higher than yours, and again, it's based on the MAGI scale that Medicaid has, and that determines, you know, even her family size may be larger. Well, actually, it may be smaller, but either way, it's based on your income as well as the family size. So that is why you receive Medicaid for your children, and she receives CHIP.
Okay.
You have anything to add to that, Mary?
No, but that's basically what it is with the difference. CHIP. CHIP is for children who have their family have like a higher income, but they're still within the income to be eligible for that program. And then also depends on how many people in your family. So that's how they decide who gets Medicaid and who gets CHIP. Okay, so the next question is, I am an immigrant, and I need to apply for Medicaid for my children. I just moved to the US about a year ago and do not have the proper documents to get Medicaid for myself, although my child was born 2 months ago in the US. Can I apply for Medicaid for her. Yes, because she was born in the United States. She's actually a citizen of the United States. So you can apply for Medicaid for your child. The only thing that you would need would be the birth certificate that you should have got issued from the hospital or from the state of Mississippi, and their social security number for your baby. Also, you have to report your household income and the number of people in your household. There are also emergency services. If you're eligible, if you've been in the United States for a certain length of time, you may be eligible for certain emergency services that they might pay. It's like a one-day services, and some kind of emergency may come up for if you have other children or other adults in the household. But that's also based on income and also based on the number of years that you have been in the United States.
Oh, right. I don't have time to complete the Medicaid application for my children because I work 12 hours a day, 5 days a week. I am off work on Saturdays, but of course, the Medicaid offices are closed on Saturdays. How can I apply? Okay, now that's where we come in. A Medicaid assister with Healthy Kids Mississippi can assist you with applying for Medicaid 7 days a week. That's right. And that's 365 days a year. The assister will need your consent, though. We could actually take a verbal consent, but we do have to have a written consent. So once you consent to us receiving your personal identifying information, then we can complete the application with you over the phone or in person. Okay, the application is submitted to the Medicaid office online, or we can drop the paper copy off at the Medicaid office of your area of which you live. And of course, within that time, after the application is submitted, within 30 days now, that is the normal time limit. Within 30 days, you should receive an approval or denial letter. Actually, they may send you have to turn in your check stubs for the previous month, but within that period of time, you should receive some kind of correspondence from your Medicaid worker, whether it's asking you to make sure that you get your check stubs in, or it's going to be an approval or denial.
Yes, within the 2 weeks of them receiving your application, if they need additional information from you, they're either going to call you or either they're going to send you a letter requesting additional information. But you still have to have it into them by a certain length of time in order for them to process your case. Okay. I recently applied for Medicaid for my child and it was denied because I did not submit my check stubs in time for the time limit they were requested. I now have those check stubs and I am able to drop them off at the Medicaid office. Can I reapply for Medicaid? Yes, but also if the time has not passed, the time has passed, but they still may have your case in a pending state. So you may not have to do another application. You may only have to submit the check stubs and they can complete your application from that. So that way you need to check with the Medicaid office and see if you need to only submit application, or do you need, submit check stubs, or do you still have to do a new application? But if you do, we can assist you with your consent, we can assist you with reapplying for Medicaid if that's the case, and also drop the check stubs off for you. And most of the workers have an email address. You can email the check stubs to them and they'll let you, and they can pull them up off their email. So it's just a matter of communicating and figuring out what it is that they need from you, whether it's just a new application or whether it's only check stubs.
Okay. Okay, let's see. There's a question. My son is 21 and needs health insurance. He just lost his Medicaid because they told me the public health emergency had ended. Okay. And he is in college. He plays basketball and football. He needs coverage because of the risk in sports. I was told by Medicaid that he can receive Medicaid. He cannot receive Medicaid because he's over the age limit of 19. What kind of insurance for him, or I can get him, what kind of insurance can I get him signed up for? Okay, the answer to that is actually the truth. He's over the age of 19, and unless he's disabled, he can't get Medicaid, but you can apply for affordable health care insurance through the Obamacare for your son through Get Covered Mississippi, another entity of Oak Hill Regional CDC. And we are a nonprofit organization that assists individuals with obtaining health insurance coverage at no cost, okay, or low cost. A navigator can be reached by calling our number. Again, that number is 662-298-3584. And Mrs. Finner gave you the text. Ms. Finner, can you give them the text, the number that they can text as well?
Yes, it's 662-689-9712.
Okay, make sure you write that number down, 662-298-3584, and you can give us a call and you will be directed to one of our navigators with Get Covered Mississippi.
Okay. I am a single father, unemployed, and raising 2 kids. Can I apply for Medicaid as the father without the mother? And yes, you can. If you the caregiver for the 2 children and the mother is not in the household, you can apply. But you can also apply if she's in the household. But if she's working, you need her income, and also she needs to be added to the application. But you can be the main caretaker or apply for the child. It's still the same guideline. It's still based on income. Everything is still the same. As long as you're not applying for yourself, you can just put an application in for the child. But if you're applying for yourself, you do have to show a birth certificate showing that you are related to the children that you're applying for. But other than that, if you're only applying for the children, not yourself, then that's not a problem at all, as long as they're under the age limit and you're following the right criteria.
Okay. And I do see another question. I am married and employed. My wife and I have 3 children. Will I be eligible for Medicaid myself? I cannot afford my job's health insurance. And you can apply, but your eligibility will be determined and based on your monthly income. And of course, Medicaid's MAGI income scale, as well as the family size. Your children also have to be under age 18, and you do have to provide proof of relationship as well as your wife's. The qualifying income, I will admit, the qualifying income is very low. But again, if you don't qualify for Medicaid, you can, we can help you by letting you look at some of the plans through the affordable health care. And there may be something that costs, well, you want to get a good coverage, but there may be something that's a little cheaper than what you pay through your employer. So there are a couple of options.
Yes, you can, and if you apply for Medicaid and they denied you, you may be eligible for a special enrollment period, because in order to apply for insurance through the Affordable Care Act, there is a certain time of year where you can apply, where it's open enrollment. So during open enrollment, you can apply, but if it's not open enrollment and you applied for Medicaid and you were denied, then you may be eligible for a special enrollment period through the Affordable Care Act. Okay. I live with my girlfriend and she has 2 kids, and she and I have 1 child together. Will I be eligible for Medicaid? She works and I am unemployed. The answer, yes, because you have a child by her. You're all in the same household. Everybody in the household will be counted. But because you're not married and you're unemployed, then you are possibly eligible for Medicaid because of the child that you have with the parent. If the other 2 kids will probably be eligible for Medicaid as well, but her income would count for them. And since you don't have an income, you would be considered eligible for Medicaid because you have the 1 child with her. So you just have to show proof that that's your child, or proof of the relationship, and therefore you'll be eligible that way.
My wife and I are both employed. Will we still be eligible for Medicaid or CHIP for our children? Actually, will our children still be eligible for Medicaid or CHIP? And the answer is you can apply, but again, there is an income limit. You can apply anyway, even if you think you may go over the income limit. Submit your monthly check stubs and wait on the letter from the Medicaid office as to whether you've been approved or denied. And if you do receive a denial letter, there's a special enrollment period with affordable health care insurance for consumers that are denied Medicaid. You will qualify for plans through affordable health care, the Affordable Care Act, if your income is at the required minimum or above. So, the main thing is don't hesitate to apply for Medicaid or CHIP, because you may even look at you may look, okay, my income and my wife's, I know we're not going to qualify, but there are some deductions. So, just go ahead and apply and just wait on your approval or your denial letter to be sure. We don't want you to miss out.
Right. It's best to apply. And if they get denied, then there's always other options that may benefit you and the children.
Right.
So don't miss out and don't say, well, I know I make too much money. Just apply anyway. It won't harm anything to apply. If you get denied, then you can always, we can always help you with other options that you may be eligible for.
Right.
Okay. How do I apply for Medicaid and CHIP for my child? You can apply for Medicaid through us with an assister with Healthy Kids Mississippi at Oak Hill CDC, Oak Hill Regional CDC, by calling us, or you can and you can tell them, well, we heard about your company on Ask Mary and Pat, and that you want to apply for Medicaid for your child. And you will be directed to an application administrator or a sister that can assist you. You can also find your local Medicaid office and apply, or through them, or apply online. We are available 7 days a week to assist you. Anytime you can call us and we can help you apply for Medicaid or help you with any questions that you might have. If you're not able to reach your Medicaid office or reach your Medicaid worker, you can give us a call and we can try to assist you and see if we can help you with any questions that you may have, especially with doing an application.
Okay. We have some of our team members joining us on the panel tonight. And Mr. Clarence Campbell, I believe he was commenting on the previous question. If insurance is offered through one's job in 2023, a job-based health plan is considered affordable. If your share of the monthly premium in the lowest cost plan offered by the employer is less than 9.12% of your household income. Okay, so that's some good information to go along with the answer to that previous question. You know, we know that you may have insurance through your employer. And, you know, a lot of people, you know, are saying, oh, it costs so much. But we do want you to know that a lot of times we look at costs first instead of the benefits of insurance. And so we really want you to look at both, not just focus on the cost. Now, I know you have to decide what you can afford to pay, but I would still advise you to just focus on the kind of coverage that you're getting. And especially, you don't know what some of us know what our needs are as far as healthcare. And again, we don't want you to just focus on the cost, just focus on the benefits of the health insurance coverage and just compare. Affordable healthcare, you have one of our navigators to compare that with your employer's coverage, what you're being offered, and even the cost, and then you go from there.
We have another one of our navigators on. Brenda, did you want to say something about that?
And did I explain that right, Mr. Campbell?
Yes, you did explain it right. Just a little bit of additional information about whether or not you can afford the insurance that's offered through your employer. Ultimately, if insurance is offered through your employer, you have to get a form, I think it's form 9065, and submit it to the Human Resource Department of your employer, and they'll put in the figures so it can be determined whether or not your employer insurance is considered affordable or not affordable.
Mm-hmm.
If based off of the formula, the employer offered insurance is considered affordable, regardless of what you might think it is.
Mm-hmm.
If the formula says it's affordable, then you will not be eligible to apply for and receive or purchase marketplace insurance.
Okay, thank you, Mr. Campbell, for that information.
You're welcome.
And so the best thing is to compare.
You have to compare, and if somebody thinks that the insurance offered through the employer is unaffordable, then what we could do as navigators is we could plug in their income figures and their family size figures and see what it would cost to the marketplace. And then based off of that, then they would be able to determine whether or not this is that monthly premium with the advanced premium tax credits would be less than of the lowest cost plan offered by the employer or not.
Mhm.
So it's not, it's something that has to be determined on a case-by-case basis.
Okay.
Thank
We have
you.
another,
Okay, you're welcome.
thank you, thank you. Do we have another question, Mary?
Yes. Can my husband have private health insurance coverage on our children and receive Medicaid from them? You can. It depends on what type of Medicaid they have. If they're on the CHIP program, you're not eligible for other insurance if they end up being on CHIP. But if they're on regular Medicaid, you can have both, and therefore Medicaid would cover, and then the private insurance, the private insurance would be the main insurance, and Medicaid would cover whatever the private insurance doesn't pay. Like if you have co-pays or some other doctors and visits or some medicines that's not covered, then Medicaid will pick up what's not covered by the private insurance. But if you're on the CHIP program, you cannot have you cannot have private health insurance.
Okay. And again, we want to thank Duke so much for steering us and in the Ask Mary and Pat, he's giving you the information. If you want, at the beginning, he gave information as to when our next Ask Mary and Pat will be held, and that is the end of July, I believe, July the 31st. We're normally on each of the last Monday of each month, 6:00 p.m. And again, we want to just thank each and every one of you for joining us, and we want you to tune in again, okay? Don't let this be your last time. But we also thank you so much for your questions. We appreciate that. And if you have any questions now, even some of the panelists, if you have any questions, feel free to submit them, and we will do our best to answer them. I have one. It says, I received pregnancy Medicaid. I have a toothache. Okay. Now, all of us that have birthed a child know all about that. But unfortunately, the question is, I have a toothache and I need to see a dentist. Can I use my pregnancy Medicaid to go see the dentist? Also, how long will I be able to receive my pregnancy Medicaid after I have my child? Okay. Unfortunately, pregnancy Medicaid will only cover pregnancy-related services. And I know if you've had a child before, most of the time we get severe toothaches during our pregnancy. And maybe they need to reconsider that, because it seems like it pops up when we are pregnant.
Yeah.
But no,
It has to do with the calcium that the baby is taking from the mom. Because whatever the baby needs comes first. And so the calcium,
oh yeah,
your calcium level will go down. So that's when you start having problems with your teeth.
okay, so that really needs to be considered. And during the pregnancy and receiving pregnancy Medicaid, because to me it is related, but it's actually not a pregnancy related condition, so it won't cover it. But previously, if you applied for Medicaid and once you had your baby, you would be on Medicaid for 60 days after you have the baby. But just recently, the end of May, that was extended. You get 12 months now. You get 12 months after you have the baby to be able to use your Medicaid. And this is just, That's one of the best things yet. You get 12 months instead of 2 months.
Right. That is great because after pregnancy, you may run into issues that are
Yes.
pregnancy related. And we all heard the numbers about the maternal deaths that we
Yes,
experience in the South. And so that helps, that extending that to 12 months really should help with the parent after she had doing her postpartum.
yes. And some, well, many actually have gone through postpartum depression after their baby is born. And so after 2 months of coverage, I mean, you can't afford to go to the doctor, after those 2 months. So now that it's been extended, that'll give you a little more time to, it will assist in getting the postpartum depression under control. So, yeah, you have 12 months now.
And that is great. That is really great. That is awesome. That is awesome.
It is.
Mhm. Okay, we have another question. Is there a certain time of the week, month, or year that I can apply for Medicaid or CHIP through Healthy Kids Mississippi? And no, there's not a certain time of any time. You can apply any day of the week, month, or year. We are available 365 days of the year. We are here to assist you and answer questions you might have or direct you to the right agency or person for answers. But we would definitely try to get the answers for you that you have. We will be able to apply for you with your consent through an online application any time of the year, anytime that because we know some people work, they may get off at 6 or 7 o'clock. So we're there, let us know, and we can help you after that 7 o'clock time. Once you get home, you can give us a call and we can help you with that. We know that sometimes you need services after hours. So sometimes you may need services before hours, like early morning, so we're available. You can just give us a call, 662-298-3584. Someone, if there's no answer, you can leave a message and somebody will definitely get back with you. Or you can give a text at 662-689-9712 and we will get back with you. I'm sure we may not be able to get back with you right away, but we will. Within 24 hours,
Definitely.
we will be able to get back with you.
Yes. Yes, indeed. Okay. I will be 19 years old on my birthday in a few weeks and won't be able to receive Mississippi Medicaid anymore because mother was told that I will be aging out because Medicaid ends at age 19. What do I do now about health insurance? Okay, as we've mentioned before, but if you're just tuning in, Medicaid was under COVID-19 public health emergency and had been since I believe it was March 2020, the beginning of the COVID-19 pandemic. And of course, the public health emergency, it actually allowed children and families to continue receiving Medicaid throughout the pandemic that would normally have been terminated because of your being over the age limit, or we actually called it, being over the age limit, or even some were able to continue to receive Medicaid because of their income exceeded the limit. But during that pandemic, you know how rough it was with COVID, and the government wanted families to still be able to receive coverage And a lot of offices didn't even have to go through the Medicaid renewals. They were automatically just rolled over. Okay, and so actually now that it ended the end of March of this year, now you should be receiving a letter if you haven't already within the next 12 to 14 months. Well, actually, since March 31st, they have 12 months to 14 months to complete all of the renewals of those that they have not done renewals, and those that are 19 years old, they have to close those cases. Now, yours could be closed tomorrow, it could be closed next month, or even maybe in October. But we want you to be prepared because it will be closed. So if your mother receives your denial letter or your closure letter, just make sure that you keep our number, and you can contact us, or you can have her to contact us. Again, 662-298-3584, and we will do our best to assist you with enrolling in affordable health care insurance.
Okay. We have another question. Will Healthy Kids Mississippi be able to help me apply for Medicaid or renew my Medicaid or my children's Medicaid? The office in our town is closed and moved to another town over 25 miles away, and I don't have transportation to get there. And that's what we've been saying all along, is that if you cannot get to an office or you have not been able to contact your worker, you can give us a call and we can help you and assist you with applying for Medicaid for your children, for yourself too, if you're eligible, and for your children as well. With your consent, we can do an online application for you, or we can make an appointment and you can meet us and we can help you do a paper application, and we will actually drop the application off for you. If that's necessary. Any other information you may have for any other proof that you may have or need to submit, we can submit those as well. So you can just give us a call, 662-298-3584. Also, you can text us at 662-689-9712. You can even, when you call the 3584 number, my extension is 107. You can request, you can put in 107 and you can, and the call will come directly to me. And Ms. Vogel's extension is
109.
109. So you can either put in 107 or 109, and you would get one of us. And the call will ring directly to us if it's after hours or the office is closed, and we'll be able to assist you the best way that we can.
Right. And we also have Mrs. May Stigler and Mrs. Doretha Knotts. They are also applications administrators. And of course, we will assist you with the application process. And we can also assist you with Affordable Care Act insurance. But of course, we have many other navigators, of course, Brother Clarence Campbell, and he's on the panel with us today. Mrs. Brenda Wilson, she's on the panel as well. And Mrs. Bettina Campbell. Now, she assists with the federally qualified community health centers services. Now, if you don't qualify for Medicaid or CHIP, or you don't qualify for the affordable health care insurance, then she can assist you with finding a federally qualified community health center and do everything possible to assist you with getting some service through one of those federally qualified community health centers.
Right. We're here to help any way we can. If you're not, as Ms. Bogle was saying, if you're not eligible for Medicaid or you're not eligible for insurance through the Affordable Care Act, then we can definitely refer you to a federally qualified health center. And we have Ms. Campbell that's worked with us, and she can help you and assist you with one in your area. And we also have navigators across the whole state of Mississippi. So if you're not in, our office is located in Hernando, and if you can't get to our office, or we have someone all the way from the DeSoto County all the way down to the Gulf Coast that can assist you with applying for Medicaid, and also with assistance you may need for applying for the Affordable Care Act. So we're all over, and it's more of us. So just give us a call, and if we're not able to assist you in the area, in your area, we have someone that's available that will be able to assist you in that area. Just give us a call and we will help you and get you to the right area.
Okay, and I do apologize, but actually I just received a text with the question, a young lady, she had applied for Medicaid for herself, and she has 2 children. And during that time, she was working full time, so she was denied Medicaid for herself. But now that she no longer has a full-time job, she is planning on reapplying for Medicaid. So you can do that now. If you're denied, and if your circumstances change as far as your income, you can reapply.
Right, you can reapply at any time. There's no limit, no time limit at all. There's no period that you have, no waiting period is what I was
Right.
trying to say. There's no waiting period. If you get denied one day, you can apply the next. If your circumstances change just that quick, you can reapply.
Okay. Do you have any other questions? I don't see any others in the chat. And I'm not sure if we have any on social media. And speaking of which, we do want to remind you that we have the new app. We want you to take the time out to download our new app. There's a lot of information about the programs that are offered, the services that we provide through Oak Hill Regional Community Development Corporation. So again, please download that app. And also on social media, Facebook, and I believe it's Instagram, you can go to the Healthy Kids Mississippi page, as well as the Get Covered Mississippi page, and there's a lot of information there. And a lot of our parents with children, some still haven't been able to, Medicaid hasn't been able to contact them to let them know that renewals have started back. And we have a lot of information on that site, on those web pages, those Facebook pages, and also our web page that you can go check out. But we want to encourage you to contact your Medicaid office. If you moved within the last 2 or 3 years, they need your contact information. They need your mailing address. They need your phone number as well as your email, but especially that mailing address and that phone number. Because if they can't contact you to let you know that its renewals have started back up, they are going to close your case. And we don't want a gap in service. We want your health insurance to keep rolling.
Yes, because if they're not able to get in touch with you, they will close your case. So it's important that if you have not updated your information, you need to contact your office and update your information so that you can be notified when your renewal is, because they are renewing everyone because of the end of the pandemic. They're going through all the cases, and some may not get a renewal notice. They might get a letter saying that they have been renewed because they were able to get information from you from their sources that they use. But if they cannot, or if that letter comes back, then your case will be closed. So you need to check if you really have not heard from them. You need to give them a call and ask them if they have sent out a renewal notice. And if they have, then, let them know that you still need to reapply for Medicaid. Either they can send you out another notice or with your updated information, or you can contact us and we will submit the application or renewal notice for you.
Mhm. Yes, and just be on the lookout as well. We're out and about in the communities. We were at several of our team members were at various Juneteenth celebrations over the last month, and Vacation Bible School. We are setting up at Vacation Bible School and at the churches. So if you know of an event you would like for us to come out and speak to the parents or the community, just let us know.
Yes, will. Just let us know if you have an event and you want us to come out and speak on our services. We have someone that'll be able to come out and speak, regardless of where you're located in the state of Mississippi. We have someone that can come out and speak on your certain events that you may have. But that looks like that's all the questions that we have. Not unless our panel, anyone on the panel has anything that they would like to say, they can unmute now. And okay, we don't have anything. So you may learn more about us at www.oakhillregionalcdc.com and www.healthykidsms.org. You can contact our office at 662-298-3584 or text us at 662-689-9712. Once again, we acknowledge our board chair, Jennifer Garrett, our executive director, Dr. Michael O. Minor, and our project director, Mrs. Lottie Minor. This has been a production of Oak Hill Regional Community Development Corporation, belonging, building, and bridging in the Mid-South region and across the state of Mississippi. So we're off now.